and welcome to The Virus. I'm Jeremy Fernandez. COVID-19 symptoms can sometimes persist for months, even years. The virus can damage the lungs, heart and brain, which can lead to long-term health problems. It also leaves sufferers with extreme tiredness, shortness of breath and brain fog. In a moment, we'll talk to one of the millions of people suffering with this condition and ask what needs to be done to avert a medical and economic catastrophe. But first, 26 million people are still in lockdown in the Chinese financial capital, Shanghai. There's growing frustration with residents scrambling to secure food with supermarkets shut down. At least 38,000 medical personnel have been deployed to Shanghai, along with 2,000 military personnel. And the city is mass testing residents as authorities stick doggedly to their zero COVID policy of eliminating the disease altogether. But there are growing fears the lockdown of China's financial powerhouse could put the brakes on the economy and impact the global supply chain. Keith Bradshaw is the New York Times Beijing bureau chief. Up until recently, he reported, though, from Shanghai. Keith Bradshaw, welcome to the program. You're joining us as a former long-time resident of Shanghai. What is the mood and the view like from inside China?
There is a lot of concern right now about what's happening, a lot of anger even about the difficulties in Shanghai. It was one thing for a lot of the inland cities or border cities to have stringent lockdowns, but it has been a shock for the people of Shanghai, many of the most educated, most affluent people in China, to be forced to undergo this kind of a lockdown where you're only allowed out on rare occasions to buy groceries, and where life in the city has practically come to a halt.
Just how strict are the stay-at-home orders? Because we know from around the world, stay-at-home means different things in different parts of the world, doesn't it?
Yes, and in Shanghai, they're very strict about it. It basically means you're not going out except for one person from the household doing rare trips to buy groceries, and then extensive testing. So they have everybody go downstairs in a residential block, usually one at a time or one household at a time, so you don't have people mixing. And then they test everybody. So they tested 25 million people in a day on Monday. They did a citywide testing. That followed testing the western two-thirds of the city in the latter half of last week and the eastern third of the city the first half of last week. But other than testing and these small trips out, sending somebody out every couple of days for groceries, people are having to stay in their homes.
What happens to those cases that are found during these routine testing measures? They're taken to quarantine centres. What are the conditions there like?
The conditions in the quarantine centres are not comfortable. There are long rows of beds, cots, in convention centers. They put out as many as 40,000 cots in the main exhibition center out on the west side of town. That exhibition center is the world's third largest convention center after Hanover, Germany and Shenzhen, China. So it is immense. And they just put tens of thousands of cots out. They provide basins in which people can wash their faces, but they're not providing showers. These convention centers were not designed for having lots of people spend more than a few hours at a time. You had an alarming incident where trash that had piled up outside the other convention center on the east side of town caught fire, and you had an outdoor fire. Fortunately, it was put out quickly, but they've also had difficulties in supplying food to these convention centers. There does seem to be enough, but sometimes people have rushed forward to make sure that they did get their food. It's not just people who are infected who are being sent to quarantine as well. They've also been rounding up people who are close contacts and sending them by the tens of thousands into confinement or even into neighboring provinces as Shanghai starts to run low on places to put all these people. Shanghai reported 21,000 new cases detected on Thursday. So they're still finding cases at an extraordinary pace.
Keith Bradshaw, thank you for joining us.
Thank you.
Briggs joins us. Casey, what's the latest data telling us about the virus here at home?
Hi, Jez. Well, it's certainly starting to look like this second Omicron wave, the one driven by BA2, is starting to recede. Here's the national case chart at the moment. We're recording about 56,000 cases a day at the moment. This time last week, it was also at about 56,000 cases a day, and it looks like it might well be starting to come down, but it's spent quite a lot of time at that elevated number. It probably will on the other side as well. So we're looking at relatively large numbers for quite some time yet. And of course, the picture is a little bit different from state to state. If we look at the per capita comparisons across the states, Tasmania is recording the most cases per million people at the moment. Thankfully, it does look like it's starting to recede there. Similar story in WA, cases starting to come downward as well. But there are still some places that cases are going up. One of those is Victoria. Victoria was, a state that was a little bit later to this second Omicron wave than other states, and what we're seeing at the moment is a very long, slow, steady increase, but right now more than 10,000 cases a day is still what we're seeing. And South Australia is, well, it's recording some record numbers at the moment, more than 5,000 cases on a daily basis, and that is higher than we've seen at any other point in this pandemic. Hospitalisations in South Australia, they're sitting at about 200. A few weeks ago, the government of South Australia said, we'll release some modelling which suggested this hospitalisation number might well reach about the same peak it did back in January. That does look now to have been downgraded, and the numbers are not quite as bad as they perhaps looked just a few weeks ago. And back to WA just briefly, because now that the wave there does look like it's coming down, we've got a sense for just exactly how big it was. And what I want to do is bring back a comparison that we looked at right when WA was getting started with this exit wave once the borders opened, and compare it to other states that had similar border opening re-entry kind of waves, Queensland and South Australia being that. So what we saw back then was that the WA wave took quite a bit longer to get going, but in the end, it's reached about the same height as those other states. So I guess, Jez, it kind of proves the point that coronavirus is coming for all parts of the country. The only thing we can really control is just how vaccinated we are before it gets there.
Casey, thank you. 36-year-old Irene Tay first contracted the virus in July of 2020 and spent 5 days in hospital before recovering from her initial infection. But even today, she can't exercise or work a full day. Irene joins us now. Irene Tay, welcome to the program. Tell me, what is it like for you having long COVID?
It's certainly not a fun thing to have. It's been challenging because the recovery, it's up and down. It's not linear.
For those who are not familiar with the sort of symptoms you're experiencing, what are they? Tell us.
My main symptoms would be the shortness of breath, my very fast heart rate, and nerve pain, and the fatigue. Oh, forgot about the fatigue. Can't forget about the fatigue.
How do you go with daily tasks and exercise?
I can't exercise just yet. Like I said, the recovery wasn't linear. So at one point I was building up being able to exercise for about 20 minutes, and then the fatigue kicks in yet again. So exercising is definitely not easy. Sometimes day-to-day life is not easy. So things like having to hang up a lot of washing, it can be so tiring that I need a nap after that.
You were working as a nurse.
Yes.
Before you got COVID. What has this meant for how you're able to work and what sort of work you're able to do?
I haven't been able to go back to my clinical work like I used to be, so I have to change the nature of my work a little. So I no longer deal with patients and look after patients anymore. I'm now more having to deal sitting on a desk or do a lot of paperwork. So the nature of work has certainly changed, and it's not it's a different path altogether now.
How do you feel about that, the fact that your career has had to take a turn that you maybe weren't expecting?
I love my job. I love being a nurse. And that change of expectation in myself was definitely the biggest challenge. Work has been really supportive in that sense. So I'm lucky, I'm fortunate in the sense that work has been able to support my change in condition and able to alter the scope of work for me to continue working. Even though I'm still not back to 100%, I still can't do a full 8-hour day.
Irene Tay, it's terrific to have you on the program. Thank you so much for joining us.
No problem. Thank you, Jeremy.
Long COVID could have a massive impact on the global economy. Dr. Richard Mead is a research fellow in economics and public policy at the Auckland University of Technology. He joins us now. Dr. Mead, welcome to the program. Is it possible to measure what impact long COVID is having economically?
I think it might be a bit premature to be able to put numbers to this, but we're already seeing large numbers of cases rising. And we are already seeing a certain number of people who are experiencing debilitating long COVID, meaning that they are chances are they're going to be not able to participate in the workforce or the education and those sorts of things to their full potential. And that's going to have short-term effects, but it's likely to also have some long-term effects.
One of the short-term effects with opening up was that we would see case numbers rise, but people would be able to get back to work, get back to life, get back to earning a normal living. What impact do you think long COVID is taking out of that?
Well, I think there's two things to consider. One is people who are experiencing long COVID, and the other is to consider people who are worried about getting long COVID. I put myself in the latter camp as it happens. So, if people are already experiencing long COVID and it is debilitating for them, and a certain number of people with long COVID are finding it to be particularly debilitating, they aren't able to participate in the work, they aren't able to participate in social life in the normal ways. So their ability to contribute as workers, their ability to contribute as consumers, their ability simply to have a normal life is going to be suffering.
Long COVID is sometimes likened to things like chronic fatigue syndrome. Is part of the difficulty that, like CFS, the symptoms, the definitions around long COVID are so intangible?
Oh, for sure. And I think we have the problem at the moment that we don't even have an agreed case definition for what long COVID is. And once we get there, chances are it looks something like what we have for chronic fatigue syndrome. And that is a fairly broad umbrella term. It's a bit of a catch-all for people with a whole wide range of symptoms and possibly coming from different sources to that wide range of symptoms. And that's going to make diagnosing what's going on with people and trying to fix what's going on with them very hard.
One of the key measures that we've moved to since different parts of the world have come out of the pandemic gradually is that we're now more focused on how many deaths there are. You're saying that that is not the full picture.
Oh, for sure. I think we have to allow for the fact that deaths are obviously important. And so as a first response, you'd expect governments around the world to be prioritising minimising deaths and overloading the health system. But the other things we need to be aware of is that people who get COVID often experience damage to various critical organs, which means longer term there are going to be burdens on the health system from those people. And then there's another category yet, which of course is long COVID. And if that leads to a significant number of the population unable to participate in normal life, that's going to lead to some very long-term costs for the society. And that's beyond the health system costs. That's actually just costs of the workforce and cost of people's life development if they can't finish their education, can't develop their careers, et cetera, et cetera.
So who should responsibility fall on? Because ultimately this ends up with the taxpayer, the employer, the consumer, doesn't it?
Oh, for sure. And I think there are a number of issues here. First is, as a public health response, governments should probably want to be leading the charge in avoiding long COVID because it leads to societal costs more widely. And government itself might be concerned if it faces long-term social care costs or social support costs, so health system burdens, ongoing care of people that are debilitated long-term. These are costs that will fall to the government, and so it might wish to try and minimise those costs. I'm actually a bit concerned that while we might see a spike in short-term health costs with long COVID sufferers trying to seek some sort of solution from the health system, unless we make some material progress in figuring out how to fix long COVID, they're quickly going to find what a lot of chronic fatigue syndrome sufferers find, as I was many years ago, that the health system doesn't actually have much to offer. And so they might end up simply running around the health system for quite some time and then dropping out and resorting to family and friends to support them if long-term social insurance isn't available, seeking alternative medical treatment if they don't find any options forthcoming in the main health system.
Dr. Richard Mead, thank you for joining us.
Pleasure.
And that is the show for this week. Thanks for your company. Bye for now.